Okay, so we have Spencer here today, and he's our patient. I'm gonna wash my hands before I start, and I'm gonna be taking his blood pressure today. I want to explain to him, Spencer, the reason we take blood pressure is just to make sure it's within the normal range, okay? And that we can continue our dental cleaning, do our dental cleaning and our dental examination, okay? Have you done anything to alter your blood pressure? Fasted, exercised lately? No. Perfect. So you wanna have their legs uncrossed, and you wanna have them in a comfortable position with their arms slightly flexed and palm up, and then you're gonna place the blood pressure cuff just an inch above the cubital fossa. Does that feel okay right there? Mm-hmm. And then you're gonna take his radial pulse, and this is how you're gonna determine the systolic. So let's see. Is that okay now? Mm-hmm. Okay, perfect. You want that to be nice and snug, and then you want to feel his pulse with the 2 fingers. And then pump up. So that was about 120. And then I'm going to deflate. And then I'm going to use my stethoscope. I'm going to add 30 to that number. Use my stethoscope. You want the ears facing forward so you can hear, and you don't want to use your thumb, and you want this end in the antecubital fossa when you're taking the blood pressure. You just want it just like this. And then you're going to hear the core cough sound. First is systolic, and the second one you hear is the diastolic. So I'm inflating, and you want to make sure the valve is turned closed. So I'm inflating. You can hear those sounds. Okay, so he was 110/70. Which is really healthy. It's within the normal range. If they are not in the normal range, then it'd be like 120/80, which is pre-hypertensive. And you measure this in mmHg, and then that'd be to 139/89. Stage 1 would be 140/90. To 159/99, and stage 3 would be over 160 systolic and over 100 diastolic. If it was over and I had to retake it, I would wait 5 minutes and retake it. If it was still high, I would have the CI come over and retake it. Wait 5 minutes, have the CI come over and retake it. And then if it's over 160, over 100, then I would escort the patient to the emergency room and document all findings in the patient's record, what arm we used, what size the cuff was, the date, and that's under BP and vitals. And that is how we do the blood pressure. Okay, we have Spencer here today. I'm going to be taking his blood pressure. Spencer, the reason we take the blood pressure is to make sure that it's within normal limits, within a normal range, and that like everything's healthy. And have you done anything to alter your blood pressure? Have you fasted or exercised before this appointment?
No.
Okay. So it looks like we can take your blood pressure now. I'm gonna obviously wash my hands and make sure that I examine the cuff, make sure it's good and that it fits properly, it's his proper size. And then I'm gonna go 1 inch above the antecubital fossa. Over his brachial artery. And make sure that's nice and snug. And then right now I'm going to try to find the systolic blood pressure. So I'm going to take his radial pulse and I'm going to pump it. I'm going to close the valve, so make sure it's tightly closed. I'm going to feel for his radial pulse. And then I'm going to pump until I can't feel his pulse anymore. Okay, so I lost pulse at around 130. So I'm going to take 130 and add 30 to that number. So it's going to be 160 is where I'm going to start. Start. And then with my stethoscope, I want to make sure that the ears are pointing forward so I can hear. And then I want to place it in my ear, and then I don't want to hold the end with my thumb. So I'm going to put it on the antecubital fossa. And then I'm going to pump it up into, close the valve, pump it up to 160. Okay, I'm going to slowly release. And I'm going to listen for those 2 Korkhoff sounds. The first one. Okay, so the first one is the systolic, and then the second one is the diastolic. And he's within normal range. He was 110 over 70, which is good. Normal range. You want to be 119 over 79. So if you're 120 over 80, that's considered pre-hypertension. If you're also pre-hypertension is 139 over 89. And then stage 1 hypertension is 140 over 90 to 159 over 99. And then stage 2 hypertension would be anything over 160 over 100. And blood pressure is measured in HGMM. And then we're going to document what we found, like what the blood pressure was, what cuff size we used, the date, and under vitals in his record for Spencer. And then if his blood pressure would have been, if the diastolic's over 120, then we would have sent him to the emergency room. If his blood pressure was over 160 over 100, we would have waited 5 minutes, took it again. If it was still over that, we would have had the CI come and take it. And if it was still over that, if it was still 160 over 100, then we would dismiss him from the office for that appointment. We also want to make sure that we disinfect the earpiece of the stethoscope and fold the cuff and store it properly in a cool, dry place.